All right, well, welcome everyone to today's webinar, Guidance for Evaluating Traffic Safety Culture Strategies. I'm going to open it up with Sue Sillick from Montana Department of Transportation.
Welcome. As Kelly said, my name is Sue Sillick. I'm the research manager for the Montana Department of Transportation and manager of the Traffic Safety Culture Pooled Fund program led by the Montana DOT. Today's webinar will present the results of one of the projects conducted by the Center for Health and Safety Culture through this pooled fund effort. Again, as Kelly mentioned, titled Guidance for Evaluating Traffic Safety Culture Strategies. I'll post a link to this project and the pooled fund program to the chat for your information. Also, the recording and presentation from this webinar will be posted to the project website as well. And now I'm going to give it back to Kelly Green from the center, who will review some Webex logistics.
Thanks, Sue. So just a couple reminders, as Sue mentioned, we are recording today and it will be made available at a later time. In case you get dropped from the Webex today, you can rejoin the audio if you have any issues by hovering over the join the audio button at the very top of your screen where the control panel is, and you can have the event call you back in. So if for some reason you're having trouble hearing and get dropped, you can call back in. The other thing we wanted to make you aware of is please use the chat box to send questions to the panelists, or you could also send them to all attendees if you'd like everyone to see them. We will have time at the end of the webinar for questions and an answer session, but feel free to send those in as we proceed through the webinar. So today our webinar will be presented by Dr. Nick Ward, the Director of the Center for Health and Safety Culture and Professor at in the Department of Mechanical Engineering. And then also another presenter is Dr. Eric Austin. He is a professor in the Department of Political Science and also the MPA program coordinator at the at Montana State University. And then finally, Jay Otto, a researcher with the Center for Health and Safety Culture at Montana State University, will also be presenting. So at this time, I'd like to hand it over to Dr. Nick Ward to tell you a little bit about the center and introduce this project. Thanks so much.
Hello, everybody, and thank you for joining us today. As Kelly said, I'm Nick Ward, Director for the Center for Health and Safety Culture. Just a bit of background about the center. We're an interdisciplinary center that focuses on helping communities to understand their local health and safety issues. We take a specific approach to look at how the social environment and how the local culture influences decision-making, both in terms of the decisions and actions of the stakeholders and the behaviors are undertaken by the people living in those communities. Next slide. The key issues that we focus on as a center, traffic safety, substance misuse, domestic violence, and child well-being, and our participation in the pooled fund on traffic safety culture is an example of our work around traffic safety. Next slide. This project we're talking about today, an examination of ways to evaluate traffic safety culture strategies, came about by recognizing the challenges ahead for us to reach Vision Zero as a national and local goal for traffic safety. We recognize that reaching this goal of 0 deaths and serious injuries will require new and innovative strategies to help us move the dial to get to zero. And those strategies largely will be predicated on changing our road user culture. But we know from looking at the literature that ways of evaluating these strategies and evidence of which strategies are effective are limited and lagging. So it's difficult for people wishing to engage in traffic safety culture-based strategies to look and find evidence-based examples of what they can use. So part of the goal for this project was to examine ways that culture is being evaluated and used in other domains as well as traffic safety, to develop some consensus on best practices for evaluating and producing evidence for traffic safety culture strategies. Next slide. So the purpose and the activities engaged in this study, we began with a systematic and comprehensive review of studies that have published evaluations on traffic safety culture. And realizing that there were not too many of those, we then did a parallel examination of evaluating culture-based strategies in other domains other than traffic safety. And by examining what has been published, how the evaluations have been designed, and the way culture has been defined, and the explanations for the relationship between culture and the outcomes, we were able to put together some guidance for practitioners on best practices for defining and evaluating traffic safety culture strategies. And with that, I'll hand it over to Professor Austin, who will give some overview on the systematic review of culture. But first, apparently, I will remind you of the agenda. We will move on to Eric Austin, who will talk about the literature review, and then we'll turn to Jay Otto, principal scientist at our center, who will bring up the idea of evaluative thinking and discuss some guidance that came out of our literature review to help us be more efficient and effective as evaluative thinkers to design evaluations that will create evidence for the effectiveness of traffic safety culture strategies. Over to you, Eric.
Perfect. Thanks, Nick. Good morning, everybody. So what I want to try to do as briefly as I can is give you a sort of a quick summary of the research design and research strategy that we use to take a look at the existing literature on evaluations in traffic safety culture, but also safety culture more broadly. And then we included an examination of the literature that we could identify within culture-based change initiatives more broadly as well. I'll walk through this sort of the design that we used as quickly as we can, and then get on to sort of what we found, what our findings were, and the implications of those to really set up, I think, the implications and the guidance that Jay will talk about subsequently. So in terms of the strategy that we used, Nick indicated, wanted to really try to get a better understanding of the evaluation approaches that are being utilized to assess the effectiveness of culture-based interventions across a variety of domains, and to understand what those designs are, how well they work, what was learned from those designs in order to sort of craft and compile our understandings into the guidance that we'll be talking about today. As you look at the image that's on the screen in front of you, this is a sort of what's known as a Prisma flow chart, or it's an adaptation of a sort of Prisma flow chart that illustrates the data that we gathered, the literature that we gathered, how we refine that down into the sample of studies that we ultimately analyzed. So we looked at literature sort of in 3 different domains, traffic safety culture being the first and the place where we really wanted to start. But based on some prior look at this literature, we anticipated that there wasn't going to be a lot here. And so knowing that we weren't likely to find a lot of studies or evaluation publications there, we wanted to expand that sample a little bit further. So we looked at safety culture records more broadly, or safety culture studies more broadly. And then lastly, culture change initiatives, sort of most broadly and most inclusively. And you can see the sample sizes, or the number of studies that we found in each of those areas. So 19 studies within traffic safety culture specifically, 100 in safety culture more broadly, and then 133 across culture change initiatives most broadly. Compiled all of those into the 152 different titles and abstracts that we looked at. We excluded 87 that were duplicates, so we searched across multiple databases for these records. Not surprisingly, some number of them appeared in more than one database. We excluded 87 that were duplicates. That left us with 161. When we did a full text examination of those records, there were a significant number of them that didn't meet our criteria, that the keyword searches were based on evaluation and culture and so forth. But when we actually looked at those records, many of them were not actually evaluations, or they didn't provide the kind of information that we needed to include them in the study. So we ended up excluding about 100 of those, or 102 of those, which left us with a final sample of 59. Those 59 then were entered into NVivo, which is a qualitative data analysis software package. And we coded all 59 of those, looking for the evaluation designs that were utilized, the industry that the intervention took place within, the findings of the study, and a number of other attributes. And we coded all of those for these different features, and then looked for patterns within them. So what kinds of designs were frequent, what industries were there, what were the results of those evaluations, and so forth. And so from there, I'll sort of jump into what we found. So next slide, please. So this isn't an exhaustive set of our findings, but I wanted to sort of highlight those that I thought were most relevant to the guidance that we'll be talking about as we move through the presentation today. As Nick and I both indicated, there were very few studies that were specifically oriented toward or focused on transportation safety culture efforts and initiatives, which is why we included those broader categories of safety culture and culture change most broadly. Across all of the studies that we looked at, we found a wide range of designs, evaluation designs, ranging from experimental designs that included random assignment into the intervention group and a control group, all the way to the sort of other end of the continuum to very impressionistic and not very systematic kinds of evaluations. There were very few experimental designs, and as you can probably imagine, carrying out an experimental design because of the challenges with random assignments into of participants into the control and into the intervention groups, those are difficult to pull off. The kinds of capacity that's necessary organizationally and in terms of evaluation expertise is fairly high to conduct an experimental design. So there weren't very many of those. But the largest number of designs, or the largest groups of designs, fell into these categories of either quasi-experimental, and that included groups or designs that had comparison groups but weren't randomly assigned. It included longitudinal studies, single group designs, and mixed methods designs that may have included pre and post-test, or perhaps post-test only. Included mixed methods approaches that may have used post-test along with secondary data analysis, and then purely qualitative designs. Those were the three most typical designs that we saw in the sample. The designs that we looked at utilized a pretty wide range of outcome or output indicators. Some number of those were focused on sort of programmatic outcomes that would include things like patient health or patient well-being, student knowledge gain, accident frequency in terms of workplace safety or safety culture kinds of studies. And then some number of the studies that we looked at as well used outcome measures that I would describe as being sort of intervening variables. So those would be things like beliefs or attitudes, or behaviors that could be measured that were assumed to then lead to sort of program outcomes. And so again, the idea here is that those intervening variables were things where culture was the independent variable, beliefs or attitudes were the dependent variable. And the notion is that if the culture change could affect those intervening variables like beliefs or attitudes or behaviors, that ultimately there would be program outcomes as a result of that. One of the other things that we saw across the breadth of studies that were part of our sample is that the vast majority of them showed positive effects or positive outcomes, meaning that culture change accomplished the sorts of ends that the researchers or that the evaluators were interested in looking at. it's probably worth noting that I think there's a certain degree of sort of self-selection bias or other kinds of bias that were likely to contribute to those largely positive effects. Researchers understandably are unlikely to seek to publish results of sort of failed evaluations or failed experiments. And I think journals also are reluctant often to publish studies that don't have the sort of effects or had negative effects that as a result of the research that was conducted. The caveat that I would add in there, though, is that if you think about these interventions and these evaluations as sort of being proof of concept, meaning does culture potentially have, or culture change efforts potentially have the kinds of effects that we would like it to have, these evaluations and the positive results that we see in the evaluations that were part of our study are actually quite encouraging, I think. Because what they widely demonstrate in a whole variety of different ways, because the strategies use lots of different intervention approaches, is that culture actually can have the sorts of positive impacts that we anticipate. So the fact that we don't see a lot of negative outcomes is actually not problematic, I don't think. I think it's actually quite positive that so many of the studies in our sample had positive effects. The last piece that I would note here in terms of our findings was that a surprisingly small number of the studies that were part of this sample that we identified included or identified a specific theoretical or cultural framework or a cultural grounding. What I mean by that is that many of these studies did not identify a particular cultural model. For example, somebody like Ed Kirshine that has a very specific sort of operational understanding of what comprises culture and how culture functions. And so these models, I think, ideally would be able to identify what are the elements of culture or what sorts of variables comprise the model of culture, what are the relationships between those variables and what potential impact do those have. And I'll sort of talk a little bit more about the implications of that here in a second, but go ahead and move to the next slide, please. So implications of what we found. Again, widely and pervasively, we saw evidence that these culture-based interventions have positive impacts or positive effects. So we were seeing the sorts of outcome changes that that the programs expected and anticipated seeing. In terms of the evaluations that were utilized and the kinds of evaluation designs that were utilized, I think widely these were quite pragmatic, meaning that they were really designed to reflect the audiences that that were important. So those could be the program managers within the organizations that were utilizing these approaches, giving them good feedback to continue to change and improve their intervention strategies. Many of the audiences were for funders so that they could make good investment decisions. In some cases, those audiences were policymakers so that they could enact sort of broader policy interventions or policy changes. The other piece of this, I think, as well, is that the designs that we saw across our sample reflected the needs and the capacity of the organizations that were carrying them out, and they reflected the needs of those audiences as well. I think broadly what that suggests is that the evaluation strategies adopted within these projects weren't aspiring towards some sort of ideal type evaluation. So they weren't necessarily aspiring towards those experimental designs that often many of us read about in our textbooks when we were in school, but really were designed to do sort of practical, pragmatic problem solving and answer very practical and sort of operational questions. As I indicated in the previous slide, one of the things that was, I think, most surprising to me at least was how few of the studies had an articulation of that clear theoretical or sort of cultural theory as a grounding and approach to the study. And I think one of the reasons why this is really important to recognize is that in the absence of that clear theoretical model, it's often difficult to create any sort of evaluation strategy, right? If we don't know what the variables are, we don't know what to measure necessarily. And so it has sort of practical consequences for, one, our ability to evaluate, but more importantly, our ability to craft interventions that are likely to be effective. So selecting or at least developing a clear theoretical model, what the variables are, what the relationships between those variables are, has programmatic consequences as well as consequences for evaluations. And so finally, the integration of that model as a reflective element of how programs function becomes important to the ongoing operations of the program. How do we engage in processes of sort of continuous improvement? And then, of course, it matters for the evaluation as well. Ultimately, having that evaluation, or sorry, that program model or that theory model in place really makes the sort of feedback loop in terms of implementing a program, learning how well that program operates, and then feeding it back into the operations of the program. Having that model makes that feedback loop much, much more robust, I think. So with that, I'm going to turn it over to Jay to talk further about what this looks like for our guidance.
Great. Thanks a lot, Eric. I think we all knew sort of going into this project that we weren't expecting to find any sort of real magic there, that evaluation is difficult in general, and then evaluation of traffic safety culture-based strategies can just be very complex, because when we're thinking about culture, we're really thinking about these shared values, attitudes, and beliefs, and that just gets hard to do. So we wanted to be able to move forward from that place and that understanding that Eric and his colleagues' work revealed, well, to not give up, but to sort of say, well, how can we move forward? And that's how we're going to talk. That's why we're going to talk now a little bit about an idea called evaluative thinking. So what I'd like to do to begin, just to to connect with you all a little bit on the next slide, if you could find your chat window and simply type in, what do you immediately feel when you hear the word evaluation? So find the chat window, make sure you say to everyone. So pick who is it to, say everyone, so everybody can see these, and go ahead and put in the chat window, what do you immediately feel when you hear the word evaluation? So we'll give a second to do that.
So Jay, there isn't an everyone option, there's an all attendees option. So if
okay.
Everyone wants to select the all attendees option.
Thank you.
Yes.
So we often do think sort of maybe results of a project, and that's a good answer, and really hone in on how you feel, a feeling word. A grade, yeah, and there can be a feeling with a sense of grade. Pressure, yep, have that sense of pressure. Feeling good. Measurement, success validation. Can be sort of a confirmation or sometimes an affirmation. A feeling around sort of being measures of performance. So it can be sort of that element of discovery. So that might have us feel curious or different thoughts, different feelings around that feeling of discovery. So good. Well, I just want to take a minute to do that. Also, feel free to use that same mechanism to enter any questions. We can see, the presenters can see that, so we can monitor those, and we'll have a chance at the end to do some questions before we conclude. So on the next slide, I just want you to see everything that I'm going to talk to you about is coming from a document that is available to you. And we'll put this link in the chat box so you can get it. It'll also be something that we'll send out afterwards. We'll also send a copy of these slides. And as Sue mentioned, this will be recorded, so you could listen to it again or have somebody else listen to it. But the ideas that I'm going to share with you come out of a document that you can actually download and print out or just share as a PDF with other folks. So know that everything I'm saying and even more is captured in this guidance document that is available to you. And what I want to talk to you on the next slide is just this idea about evaluative thinking. So while Eric was really looking at studies that were exemplifying various forms of evaluation, often formal evaluations, we can also recognize that we, all of us, in all of the work that we do, can engage in evaluative thinking. And the idea of evaluative thinking has come up, not by us, but by lots of other researchers. And it's recognizing that some of the activities we're seeking to evaluate are very complex. And it is very difficult to evaluate them. So while we might think of classic random controlled trials for drug studies, these are individually focused, and we can design, for the most part, pretty well-structured experiments to test drugs. But when we're thinking about culture, it can become extremely difficult. Random assignment, when we think about a larger scale, a community or an organization, becomes difficult. It just is very complex to imagine. And around the globe, many governments are engaging in efforts to increase their evaluation. How well are the services that they're funding working? Are they making a difference? So there's a lot of interest around the globe on this issue. And some evaluators are thinking about this idea of, well, we need to just branch out and expand our notion of evaluation and really promote evaluative thinking. So it's this idea that's really motivated by an attitude of inquisitiveness. Somebody had mentioned sort of discovery, that idea of being curious. And that's an extremely important part because, and Eric mentioned this too, evaluation has this element of being a part of like a learning organization where we're seeking to always learn and improve. And so bolstering this sense of being inquisitive, of being curious, of asking questions where we can continue to improve the strategies that we're using. It's also motivated by a belief in the value of evidence, right? And I think many of you would realize that if you went to a stakeholder or a funder and you said, I have clear evidence that this strategy is effective, it's much easier to get people to fund that, to get people to adopt that, to participate in that. So evidence can really motivate action, adoption, support, all sorts of things. But we often don't have the evidence, so it's thinking, well, I value evidence. How can I start to gather evidence in multiple ways? And evaluative thinking is going to be involving some skills like identifying assumptions. This is going to be extremely important, and we'll talk more about this and make this real. But it's this idea of uncovering what assumptions are out there, and then posing very thoughtful questions, perhaps questions that we can answer. Not all of the questions we ask we can answer, but maybe some we can. And if we're constantly posing thoughtful questions, that may lead us to situations where we can start to answer more of those. And then using those questions to really foster a deeper understanding and some reflection and perspective taking so that ultimately we can make more informed decisions in preparation of action. I mean, I think this pooled fund project around traffic safety culture is motivated, and I think a lot of traffic safety work is motivated around the idea of towards zero deaths or vision zero, that we want to reach 0 deaths and serious injuries. And that's going to require action. We're not going to get there doing the same things we've always done. It's going to require us to do new things, more things, different things. So it's going to require action. And any way we can be informed in making that action, we can be more effective, we can get there quicker, but make better uses of resources. All right, so what might this look like? Well, on the next slide, we can just use a couple of diagrams that might help us think through about applying this. So the top little diagram there is a very simplified behavioral model. So that's kind of how we at the center think about behavior, that with any intentional behavior, I have a whole set of beliefs associated with that behavior. And the more supportive those beliefs are of the behavior, the more likely I'm to engage in the behavior. And if I have beliefs that are not at all supportive of the behavior, I'm much less likely to engage in the behavior. So maybe wearing a seatbelt, that's a behavior I can engage in. I can have a certain willingness and intention to wear a seatbelt. I can have attitudes and beliefs about wearing a seatbelt, and I can have a host of values that transcend seatbelt use, but just are values in general, like I value my health and safety, or I value the safety of other people in the vehicle with me. And all those beliefs can come together and impact my seatbelt using behavior. But there are a whole host of behaviors we can think about, and not just driver behaviors, right? There are road user behaviors, but there are also all the behaviors of stakeholders. Engineers make decisions about designing roads. Planners make decisions about road design, where they are, how the capacity and different things. Law enforcement make decisions. Elected officials make decisions. Traffic safety professionals make decisions. So behaviors are everywhere. And these behaviors are very intentional and can be influenced by the values, attitudes, and beliefs and willingness. So if we want to grow new behaviors, our efforts are really going to be about sort of growing these supportive belief systems that lead to those behaviors. So on the bottom, you can sort of see maybe an unfolding of a series of activities or the way things sort of logically unfold when we think about a traffic safety culture strategy, a strategy that's trying to change shared beliefs. So on the far left, we're going to begin with some sort of strategy or countermeasure. Our goal is that strategy or countermeasure somehow changes people's beliefs, that those changes in beliefs change people's behaviors, and of course, as their behaviors change, that may feed back and reinforce and even change more beliefs. It's not always just this linear. But those changes in behaviors are going to impact crash involvement, the types of crashes, maybe the severity of crashes, and ultimately leading to better traffic safety, where we're seeing reduced fatalities, reduced serious injuries. So if we think about applying evaluative thinking in this context, we can look for opportunities where we might start to ask some questions and examine some assumptions. And really, we want to keep in mind that the behaviors we're seeking to change aren't just road users. When we really think from a safe systems perspective, there are many stakeholders involved in the transportation system, all of whom can shift some beliefs and change some behaviors to support a safer overall system. So we really want to think broadly, but we'll think about this idea or this strategy or countermeasure in a particular context. So on the next slide, we might think about three general kinds of evaluations. And these are described in that guidance document. You'll hear evaluators talk about these kinds of evaluations. So it's good to get the language because they do sort of focus on different things. And we'll look at how each of these kinds of evaluation, process, outcome, and impact relate to our sort of little theory of change and our behavior model. So let's go back on the next slide and think about we're going to have a certain strategy and we're going to apply that strategy to a group of people. Maybe it's a small group of people. Maybe it's we're going to provide training to law enforcement officers about how to detect impaired driving, right? So we're going to do some best practice training. We're going to build the knowledge, the beliefs of those officers, which will enhance their behaviors, their enforcement behaviors, to be able to identify drug-impaired drivers. And so that's our strategy. And then our notion is if we can identify more drug-impaired drivers, we can keep them off the road, we can reduce those crashes. Maybe we also get some deterrence theory going that people realize they're going to be detected more so they don't even drive, and then ultimately improving traffic safety. But the core strategy, let's say we're trying, is we're just going to do some training with officers. Well, through process evaluation, and you can do the next click, Kelly, we're going to start to ask some questions and just ask specifically about the intervention we're doing, which is training. You know, was the training implemented as it was designed? We're assuming that there's some training that we're using. We're not developing it from scratch. Maybe if we are developing it from scratch, then it's extremely important to wrap some evaluation around it. But if we're just replicating at a training that's already been used, was it replicated well? Did we include all the components? Did we skip any parts? Did we run out of time? Did we not have the necessary materials? This is the kind of stuff we want to look at in process evaluation. And did it reach the intended audience? So did I have the people I thought I was going to train, were they in the room? Now, let's think of another strategy, like a big media campaign. Well, we might think about, did we implement the campaign as it was designed? In other words, did we have enough impressions and was the dosage high enough? And we might ask the question, did it reach the people we were trying to reach with the media campaign? Because clearly, if the people whose beliefs we're trying to change with the media campaign don't even hear the media campaign, it's very unlikely it's going to change their beliefs. So this process evaluation are questions we can ask very, very early. We're not going to make any assumptions that these things were done. We're just going to ask some questions and try to gather some information to inform, and that may improve, that alone may improve the quality of our intervention the next time we implement it. Process evaluation is extremely important and something we can do just to see if the intervention was done as we thought it was done, or the strategy or countermeasure. On the next slide, we can apply the idea of outcome evaluation to say, okay, we did the strategy. Did it change? Did it create the changes that we thought it would? I mean, if we did training, did people improve their knowledge? Well, we could assess that, right? We could do a pre and a post test of the training, or just a post test, or maybe some training has some elements of evaluation or having people complete a performance test or some other test that we have a sense that they got the skills and the knowledge. And if it's behavior-based too, maybe the behaviors that we were trying to grow. And then we can, down the road, assess, did those changes in beliefs lead to changes in behaviors? We don't want to make that assumption and simply wait down the road to see if traffic fatalities decrease. We want to look earlier if we can see behavior change. Now, sometimes this is difficult to do. Sometimes this might require us to do additional survey work or look at other sources of information. But again, the more we can start to think this way and bring these ideas into our investments of countermeasures and strategies, the earlier we can see if things are likely to make improvements in the final outcomes of health and safety or not. Because if we just wait, we may invest lots of money over many, many years and have no outcomes and not really even understand why. So this outcome evaluation is this opportunity to look at both short-term and intermediate outcomes and see if we're seeing change that we anticipated. And then finally, on the next slide, we can really think about, okay, are we having the impact that we wanted? So if we're changing behavior, did that ultimately lead to the changes in terms of consequences? And often in traffic safety, the consequences we're trying to reduce are maybe high energy crashes or overall crashes in general, and then ultimately we're trying to reduce fatalities and serious injuries. So we want to look at, are we seeing those kinds of longer term impacts? And with a lot of countermeasures that we do, it may take years to get there. So that's why it's really important to do those process evaluations and some of those outcome evaluations so we don't have to wait all that time to see change. It's also extremely important to ask, were there unintended consequences? Maybe there are consequences we didn't even think were going to happen, but they did. Maybe positive, but also maybe negative. So we want to look for those too, because there have been historically examples of strategies which have had unintended negative consequences. They actually made things worse. And we don't want to do more of that, right? So we want to look for that and seek to understand that as well. So this just becomes some important ideas that we can think about how we might apply ideas of process evaluation, outcome evaluation, and impact evaluation, even in small scales that each of us could do and to bolster overall evaluation in general. So on the next slide, there are just some questions for you to think about. And in all of these kinds of evaluation, we're really trying to identify our assumptions. What assumptions have I been making? How can I pose some thoughtful questions that we might actually be able to answer that allows me to get a deeper understanding of what's going on and to have a better perspective about how countermeasures or strategies are being implemented. and ultimately improve the decisions that maybe you make or other stakeholders make in terms of investment of time, energy, and resources. So I'd hope you just take a moment. These are just rhetorical questions for you to reflect on, but how might this sort of change your thinking about evaluation? And how might it change your thinking about what you can do in your role? Yes, we'd all like to be in a situation where we could outsource evaluation or hire external evaluators, but we might not have the resources to do that, and it might just be very complex to do that. So how could we just incrementally add more evaluative thinking? And I want to briefly mention we're doing an exciting project with a statewide organization. They're responsible for all their traffic safety efforts in the state. So they're doing their strategic highway safety plan and taking federal and state resources and investing those in various programs and strategies, countermeasures. And what they're going through, they've gone through and mapped for all their strategies, what is the theory of change that leads us to understand this strategy is going to ultimately result in improved health and safety. And so they're really thinking through what is this strategy doing? What are the short-term outcomes, the intermediate outcomes, and the longer-term outcomes? And the next phase they're going to do is actually develop a deeper version of that with what we're going to call logic models with every contract that they're going to do. And how can I add some process evaluation to those contracts? How might I be able to start to even look at and measure short-term outcomes? Maybe that the contract can do intermediate outcomes, or maybe we have to look at a bigger or different system to look at some of the intermediate outcomes. But how can we really bolster evaluative thinking across all that we do to really make us better at designing these program plans where we're addressing issues like impaired driving or occupancy protection or young drivers or other issues like that? So this is absolutely resources and ideas that I think folks can apply both at the federal, the state, and the local level, and we can all sort of think about ways to grow our evaluative thinking. So on the next slide, just a reminder, this is a completed pooled fund project, so there is available a final report that goes into much more detail about Eric's findings. You can also download a copy of the guidance document that I just gave you a little bit of ideas about, but it has a lot more depth there. There's also what we call sort of like a summary poster. It would be something that could be potentially used in a research setting, but you might want to look at it as, and it's just something that you could print out on a large size piece of paper, multiple pieces of paper that summarize all the findings from the project. And so those are available for you all to download and access. I will briefly just outline or talk about some other pooled fund research projects that have been completed recently. So there is we did complete a project, Nick Ward led a project on looking at key information for driving under the influence of cannabis. So if that's an issue that's coming up in your area of interest, that's something you might check out. It's got some great summary information. There's also a primer on traffic safety culture, as well as some PowerPoint slides and other resources there, as well as a primer on proactive traffic safety, this idea that we can reach out not only and engage in the safety, in behaviors that improve our safety, but engage in behaviors that improve the safety of others. There are other projects that have been done on the pooled fund as well as a part of the pooled fund, so I'd really encourage you just to check those out, but those are three that we've completed recently that I think are particular value in terms of having some great tools that folks can use. And just to make you aware of some research that's currently underway that will be wrapping up pretty soon, we've been looking at providing some guidance on messaging to try to avoid psychological reactance and moral disengagement in the context of seatbelt wearing and aggressive driving. We're also looking at some tools and resources to increase engaged driving, in particular trying to decrease distracted driving. And we're looking at it in two contexts. In the context of a family, so how might a family have a conversation and establish some family rules about not driving distracted, not just cell phone use, but that's a big one, but other things as well. And then also in the context of a workplace. So how might supervisors have conversations with the people they supervise who drive for work to try to reduce distracted driving and increase engaged driving? So that is a little bit about some other projects. We have a period of time now where we can address any questions that come up. You can feel free to put those in the chat window. And I don't know, Kelly or Karen, if you've seen any come through. I've been keeping an eye on the chat, but I've not seen anything come through. Have you all?
No, I have not.
All right. So feel free to enter anything into the chat window if you'd like. And I think I see, there's something here. Not sure if a full question came through. There was somebody who I just saw one word as a question. It was subjective, but I don't know if there's more to that question. So you could also potentially use the question and answer box, but also the chat box. I'll just, if we don't have any questions or comments coming through, I think I will turn it back over to Sue, who can wrap things up.
Thank you, Jay. Yes, while I'm speaking and taking a little bit of time here, please, again, feel free to put any questions in either the chat or the questions box. I would just like to thank Nick, Eric, Jay, and Kelly for today's presentation. I'd also like to thank the states. I was going to list them, but I see they're right here on the slide, and you don't have to sit through me naming them all, for sponsoring both Phase 1 and Phase 2 of our pooled fund. And like Jay said, this is just one of a number of projects that we've conducted through the pooled fund. And finally, I'd like to thank you, the audience, for your interest, time, and thoughtful questions. I'm still not seeing any questions, so I think we can probably close the webinar. I'll leave it, Kelly or Jay.
Sure. So I did see one come from, I saw one question come through. Are there interim evaluations that can happen within the behavior change model? So I think that's a great question, and I think there are. I think depending upon the strategy that you're using, there are definitely ways that you could explore how, like, for example, what belief am I trying to change? And how might I measure changes in that belief in the very short term? There might be quite a bit of time between changing beliefs or required to change beliefs and changing behavior, but some strategies might involve or anticipate belief change very quickly. So if you're doing a training, you might anticipate that at the end of the training, people's beliefs have changed. So that would be a great opportunity at the end of a training to really assess, did beliefs change? Do people feel more comfortable, confident to engage in whatever the training was trying to increase their skills or their behaviors in? And then you could do potentially some short-term follow-up to see if their behaviors are changing. When we think of media campaigns, I think it's always valuable to do look at some ways to do some very short-term checking in with folks. Are they even hearing the message? So this is sort of a process measure. They might not believe the message. They might not change their own beliefs based on the message, but are they even hearing the message? Because if they're not even hearing the message, then we know we might need to change sort of the channels that we're using to reach them, whether it's social media or universal media or whatever mechanisms we're using. And then we might follow that up in terms of, are we seeing belief change and then ultimately behavior change? But I think there are definitely ways that we can add to very short-term projects some mechanisms just to start to garner some evidence that the intervention I'm investing in, whether it's a training or a media campaign or a policy change, things like that, are people aware of it? Are they starting to shift some of their beliefs? Are they starting to shift some of their behaviors? There's a lot of investment, for example, on high visibility enforcement. And the notion is that if we have an increased high visibility enforcement, it increases people's perception of getting caught if they violate the law or whatever behavior is being addressed. And that's something that we could potentially assess. Are people's sense of getting caught increasing as a result of the high visibility enforcement? And we find a lot of organizations don't really look into mechanisms to even assess that. And so are people aware that high visibility enforcement is occurring? I mean, there are a number of things that we could start to explore just to see, even if awareness, even if some of the early process measures are taking place. But again, it's asking that question and thinking through, what is the theory of change that I have for this strategy or countermeasure? And then given that, what are some questions I might ask along the way that could help me better understand whether it's working the way it's supposed to? It's unfolding the way I'm assuming it is unfolding, because it's all about examining those assumptions.
So it does look like we've gotten 2 more questions.
Yes, so I see one. I see phase 1 and phase 2. Will there be a phase 3? Oh, well, we're right in terms of pooled fund. We're in phase 2 right now. So we're just in the first year of phase 2. So if you're interested in joining as a pooled fund, you can reach out to Sue. You can email her, and you can absolutely explore different ways that you could participate, either as sort of a friend of the pooled fund or as a sponsor. But phase 2 is still very active and open, so feel free with that. And then, are there studies that have measured the time it takes to move from change in belief to change in behavior? There are some, and it varies depending upon the strategy that's being used. It can take quite a while for certain strategies. We've been involved with projects, for example, that are trying to change beliefs, to change behaviors, and are using sort of universal media in different forms, and that can take years. You might imagine a very intense training where we might see belief change at the end of that session, and we might see behavior change very quickly after that. So it really depends on the strategy. We could see, maybe a more intense intervention with certain folks, and our goal is to see belief and behavior change quickly. We might see a change in a policy that could take years to educate people about and to start to shift their behaviors. So it really depends on the strategy and kind of in some ways the dosage, how much you're able to bring the new information to those folks. The adoption of evaluation within an agency could be looked at as a culture change exercise. Exactly. So that's from Wade, one of the leaders we're working with. This whole notion of growing evaluative thinking is an exercise in changing one's culture, right? I very intentionally asked you that question about how you feel about evaluation, and a lot of people don't feel great about evaluation. Either it's sort of unknown, it's boring, it's where people just go on and on about all these numbers that I don't understand, or it might be scary, like I don't know that I want everybody looking into seeing how effective or ineffective we are. So there are all sorts of feelings that we can have about evaluation. But sort of growing evaluation thinking is an element of an organization's culture and requires some belief change as well. So sort of talking through that, building the courage to ask difficult questions, going into the unknown. Like, I don't even understand how this strategy that I'm investing in really works. And maybe I just don't know, so I've got to spend some time to figure that out, which can be daunting to folks. But that's a great point. Let's see, anything else come up? Are those studies nationwide or related to specific states? So depending upon, I'm not sure exactly which studies you're referring to, there are, most of the studies that I've seen tend to be, especially around traffic safety culture, tend to have a narrower focus than the whole nation because of just the cost of studying the whole country. Like the shared beliefs across the country is a big system. So often when we look at culture strategy evaluations, they do tend to be on sort of more focused populations because it's just a little bit easier to measure. But I'm a little cautious just because of the general nature of your question. Do you have any examples of unintended consequences that you could share? Sure. Unintended consequences, I think, could be a number. there have been national campaign strategies, for example, to address, it was done in the early 2000s. There was a national campaign to change beliefs about cannabis use or marijuana use. This was not a traffic safety issue, but this was a misuse of substance issue. And the federal government spent about $1 billion on a national campaign. They did ask for it to be evaluated, and the evaluation actually shown that the campaign potentially increased cannabis use. It didn't decrease. It increased beliefs supportive of using cannabis, which was not the goal. So there can be sort of those unintended effects or sort of opposite effects. I think another unintended effects that can occur, for example, when we think about traffic safety culture or traffic safety and high visibility enforcement, an unintended effect is that we can see an increase of disparities. So we can see certain racial populations in certain areas having more interaction with law enforcement than other racial populations, and that resulting in greater disparities of arrests or imprisonment or other things like that, which I think might be an intended consequences in some communities, or it could be an unintended consequence. But it's a consequence that I don't think was solely born in terms of a goal of improving traffic safety. Your question was around the 59 studies mentioned earlier. So, Eric, are you still on? The 59 studies, those were probably not national or state, but a variety of different domains, right?
Yep, that's exactly right. So many of those, because so many of those were focused on culture change interventions at an organization or industry level, many of those were internal to particular organizations. Some of them were within specific sort of political jurisdictions, so local or state level. I'd have to look at the full list. I don't recall any off the top of my head that were nationwide. There were a handful that were international as well, so the design we used didn't exclude studies that were done internationally. They were all published in English, but we did have a handful from Western Europe particularly. But even there, those were specific to industries or to particular organizations for the most part.
Great, thanks. I think we're about out of time, or maybe over time a little bit, and I don't see any more questions. So thanks everybody for your participation.